Hi, Kay, honey. I hope you're doing well, and I hope you got some Dairy Queen in the midst of all this craziness. But I have my Docucare Sign Off prepared for you. So I'm just gonna go through based off of what we talked about in the email, and then if I miss anything at all, just please let me know, and I will gladly call you on our Zoom time, okay? So my client is a 10-year-old Caucasian male. He is in the 4th grade. His height is 57 inches. His weight is 78 pounds. He has allergies to pollen and dairy and grass, and also sulfa antibiotics. So his reason for being admitted is because he has a fracture. It's a green stick fracture to his tibia on the right lower extremity, and then he has a transverse fracture to his fibia on the left. He has no past medical history other than a skateboarding fall in the past that didn't lead to anything. He's got 2 parents and 2 younger sisters. He has a previous medical history of asthma, which does play a part in his hospitalization for the case that they gave us. So his fractures were due to a scooter accident. He has bilateral lower extremity lacerations. His right one is longer, and it appeared oozing blood upon admission. He has minor abrasions on his fingertips, and he claims something scratched his right eye. So when he first came in, he showed signs of a fever, accelerated heart rate, and accelerated respirations, with left ear pain and purulent drainage. So my first thought was infection because of the fever and the purulent drainage. And I think that's it for just his client record and as far as history goes. So the increased heart rate and respirations is important in the fact that he also has asthma. So this is kind of how I put 2 and 2 together. The nursing diagnoses that were already in the chart had impaired gas exchange, which was resolved by the 2nd day he was in the hospital, but the impaired gas exchange, because his increased respirations and because of his asthma, it was hard for him to get enough oxygen. Then his other diagnoses were acute pain due to the fracture, impaired bed mobility, fracture, hyperthermia, and then risk for corneal injury, but that was resolved because they thought that he had a corneal abrasion. So his vitals, I noticed there was a pattern. So on the 27th is like the time that they noted his vitals, and they had 3 sets of vitals, and it was the 27th and then 2 sets on the 28th. So within a 24-hour period, his heart rate dropped from 120 to 100, which was good. They got his heart rate under control. His respirations were kind of wonky. They went from 22 to 28 to 24. And then what concerned me was his SAT level. He originally came in on room air at 96%, and then when they did it the 2nd time, he was at 95, and then the 3rd time was 93. And then he had orders to get nasal cannula oxygen. So the oxygen was enough to regulate it and get it under control, and also help with his bronchospasms from the asthma. The other vital sign that went down, which was really good, was he had a fever in the beginning, which I'm assuming because he had a topical antibiotic, which we didn't really talk about, and the purulent drainage and the fever. So they were doing that, and they were also giving him acetaminophen and liquid Tylenol. So those helped bring his fever down. He originally had a 103.4, then the 2nd time was a 101.8, and he was down to 100.2 by the time I'm seeing him. Okay, so that's vitals. So then I went over like the assessments and stuff, and I thought it was important that they noted his hearing was intact bilaterally as well as his eyesight. So that kind of cleared up the issues with the purulent drainage and the pain in his ear, as well as the scratch of his right eye that he thought he had. It mentioned he has 2 IVs in his left arm and his right median. I can never say this, antibrachial vein. but both are intact, dry, no redness. I paid a lot of attention to the musculoskeletal assessment part. So he had traction leg braces. He had pain related to his fracture, obviously, but he was coping well. It was acute intermittent pain, and it was inflamed by movement, and it was alleviated with rest. And he originally was saying he had a pain level of a 4 on a scale of 10, and then it went down to a 3. So the pain medications that we were offering him was alleviating his pain. So he had a left lower extremity and right lower extremity visible muscle movement, but not at the joint. So that was his fracture. And then he had passive range of motion in both those the lower left extremity and the lower right, but the upper right and the upper left did have active range of motion. Then for the lacerations that they assessed, his larger laceration on his right knee was the entire right knee, and he had erythema, bruising, and itching, and it was a 5 centimeter length by 0.2 width laceration, and that is where they were putting the antibiotic ointment, and that was topical every 8 hours. And then he also had like a very minor right palm abrasion that was 2 centimeters length by 1 centimeter width, and he had erythema in that area. Okay. So he's got a lot going on for a 10-year-old boy. So these are the medications that they were giving. So I put down 2 of the oral meds. So he had, both of them were PRN, and he was getting acetaminophen Q4 hours, and he was getting 480 milligrams of that for pain. And the education there is that he shouldn't have it more than 6 doses a day. Liquid ibuprofen was also given PRN, 300 milligrams Q6 hours, and that was as needed for his temperature. So if it went above 101.5, they would give him that. And since the last vital sign temperature that he had was 100.2, he shouldn't have to get that. So that should be held unless his fever spikes again. So then I did the IM meds. So as he's in there, as if the kid's not going through enough, we're like, hey, you need your flu shot. So he needed his influenza shot. The needle length I would use for him is a 5/8, but you could use a 5/8 to a 1.5. And the reason I did that is because he's a normal height and weight, but you're supposed to base it off of like how much medication and the muscle. So I don't know how muscular this kid would be. So they always say to go the smallest needle size and gauge. So I chose the 5/8, and the gauge could be 22 to 25. So again, I would choose the smaller one. Technique. So I know you avoid the dorsogluteal now because children could suffer. Oh my goodness. I don't even want to look at my index card because I know it's there. It's just a brain fart. The sciatic nerve. So instead of risking damage to the sciatic nerve, they no longer do that spot on children. So I would go for the deltoid. So the deltoid, you're going to locate the lateral side, and you're going to do the top third of the muscle, and it's 1 to 2 finger breadths below the, I can never remember this word, the acromion process. So 1 to 2, so it would be about here. And you're injecting that at a 90-degree angle. And because of his age, he's a preschool child, he can get 0.5 to 1 milliliters of that. And his injection was, the dose for that was 0.5 milliliters, so that's perfect. And it would do rapid injection, and they no longer aspirate. And truly, I don't understand the aspiration thing anyway, why that was originally a thing. So if you got tips on that one, I'd be interested to know. I think that's all you need to know for that one. So that's his IM med. Then I wrote, so his inhaled med was albuterol sulfate, and that is 180 micrograms. And he is to get the peak flow meter before and after each dose of that. So he's scheduled for Q6 hours, and it's a meter dose, 2 puffs. You're going to, I don't know, I guess the education for that would be smart now. So the child should first exhale completely, and then you're going to inhale slowly and deeply. You're going to hold it for 10 seconds, exhale, wait a minute in between puffs, since he has a second puff ordered. So wait that minute, and then inhale again, wait the 10 seconds, and then he's good. And a little bit of education there, they can rinse their mouth out so that there's no irritation afterwards. And I do have the peak flow meter education. I'm not sure if you needed that, but here it goes. So you slide the arrow down to 0, stand up straight, take a deep breath, close the lips tightly around the mouthpiece, and you blow out hard and fast. You note the number that the arrow moves to. You repeat this 3 times, and you record the highest reading. And for my patient in particular, sorry, that was my dog at the door. And for my patient in particular, because he's getting this before and after his albuterol, you're going to do that 3 times in the beginning, give him his albuterol, and then 3 times afterwards, and you're going to note the highest. And then there's peak expiratory flow rate, which is usually done on the child when, what is it? It's their personal best, and it's when they're symptom free. So he wouldn't be doing that right now, but it goes by green, yellow, red, and it's if you're in good control, if you should be cautioned, or if you need medical attention. I think that's all you need to know for that. Yeah, and I can see why for my patient, getting the albuterol and the asthma under control was so important, because he was in pain, which his respirations are going in, and he's already got asthma and he's already medicated for it, so it was probably exasperated and making it very difficult for him to breathe. So with the medication, his respirations are coming back down, he's getting more oxygen with the nasal cannula, and he's still in pain, but he's getting a little bit better under control with his acetaminophen. So then I also just, for some considerations for my patient, because he's a school-age child, he's in the 4th grade, you want to remember that they should have a role in their care. Explain his medical care in simple terms that he can understand, and allow as many choices as possible. As simple as, like, do you want to take your pink pill or your yellow pill first? And then you also want to seek for their assistance, like with little things that they can help with, putting the medicine in the cup or whatever, just to kind of give them a little bit better sense of control. Another super important consideration is just incorrect dosing has been the #1 med error. I got that in my textbook. So just making sure that you're vigilant and it's the correct dose, whether it's single dosing or the 24-hour dose. And you always want to assess for therapeutic effect. Is the medication even working? Is it subtherapeutic? And of course, if there's any signs of toxicity, because children, that's a biggie. Okay, I think that's it, Kay. That's all I have for you. Please let me know if I missed anything, if you need me to repeat anything, or whatever, and I will gladly do that for you, and I'll be able to do that on our Zoom call tomorrow, I think at 5:30? I have to look. Alright, darling. Have a lovely day. I don't know if I ended this. Please hold. Nope.